With healthcare, there's never a dull moment. I've been asked by many news outlets recently about some of the big changes happening in healthcare, especially this year. I do feel like we as a country, we're getting to a tipping point where healthcare is no longer affordable for not only individuals, but also companies and institutions such as the government. So in many parts of the country, especially in the Northeast, where we have a lot of clients, we've been seeing health insurance companies propose extreme hikes. Previously, health insurance was already expensive. We saw increases upwards of double digits, 10% increases on health insurance. And this year, we're expecting 20 to 30% proposed increases on health insurance, which, if you can imagine anything going up 20, 30%, your electric bill, your food bill, some of us saw that in the last couple of years, it's unsustainable. And many companies that we work with, they budgeted a 10% increase in health insurance. And I keep on going back to the example of Starbucks spends more on health insurance than it does on coffee beans. So to see another 20, 30% increase on that is detrimental to most businesses, because many businesses out there, they don't make very much money. If you look at grocery stores, even if you look at hospitals, their margins are in the single digits, which means that they make pennies for every dollar that they take in revenue-wise. So for them to absorb 20, 30% increases on health insurance, again, it's unsustainable. So what's going into that? One is increased cost of healthcare. We see a lot of the GLP-1s, the weight loss drugs, hitting the market. Even though they are effective, people are losing weight, which is fantastic. It comes at a big cost. Some of these medications are $10,000, $20,000, $30,000 a year for the prescription. There are lower cost alternatives. There's some battles around intellectual property, so we're going to see things fluctuate there. And then also, you're seeing hospitals charging more and more because labor is more expensive. A lot of provider groups are consolidating. There's more infrastructure. If we look at some of the expenses in healthcare, we're seeing that there are more administrators than ever before. So the cost of administering healthcare has gone up, increased payroll. So you're seeing increased therapies, increased expenses associated with running hospital systems. And because of that, you're getting those costs passed on to the insurance companies, and then the insurance companies are passing it on to consumers. And also, we're anticipating a lot of Medicaid cuts. And for places, small state like Rhode Island, where again, we do a lot of business, a third of the population is on Medicaid. And Medicaid, frankly, just doesn't pay that much, which means that providers now have to get their subsidized costs from other parts of the market, such as commercial insurance, Medicare, and so forth. So how much they charge those institutions will go up. And that's also, again, affecting the balance of the costs. So we're going to see this battle go on for at least the next couple of years, and whether or not it's going to be sustainable for the end user is going to be up for debate. So again, big things to watch out for, and we're going to talk about some of the solutions. Again, these solutions are not going to be easy, but I do believe that there are solutions out there.